I'm Dr. Elizabeth Fay, and I'm a physical therapist specializing in pelvic floor dysfunction and rehabilitation. Thank you everyone for tuning in, and I hope you are all as excited as I am to learn more about what pelvic floor physical therapy is, some of the common symptoms of pelvic floor dysfunction, and if you can benefit from pelvic floor exercises. There's a lot they don't tell you about what to expect postpartum, right? And leaking urine during activities, or in general, is a big one that no one wants to talk about because it is private and embarrassing. I'm here today to put those feelings to rest and talk about how to help these issues after having a baby. First, I'd like to share why I became interested in pelvic health physical therapy, because it has truly impacted my life for the better. I had some type of urinary issues since I was little, but I really remember it starting to impact my life when I was in high school. I began to realize a lot of the issues I was experiencing weren't normal. I was a dancer for my high school dance team. This included poms, lyrical, hip hop, etc. I say this because it included a lot of jumping, twisting, and turning movements. I would start to have drops of urine in my underwear when I would drum too hard, and I would also have the sudden urge to rush to the bathroom in fear that I wouldn't make it without a couple of drops of urine coming out. This being said, I was scared, embarrassed, and afraid to tell anyone about my issues. I could tell at this point it wasn't normal. I was afraid to tell my parents, friends, or even admit to myself that the issues were happening. Without addressing these issues and continuing my same habits and dancing throughout college, I continued to struggle with these issues. It wasn't until I was in physical therapy school and we had a pelvic floor physical therapist come and talk with us. She started to talk about common symptoms of having weak pelvic floor muscles. This included leaking urine and having that sudden urge to rush to the bathroom. I remember sitting there nodding, yes, as that all of these symptoms and issues were things that I had personally experienced. I finally had a glimmer of hope. I was able to apply the material and exercises that I learned in that class today, as well as through my clinical rotations and other classes, to apply to myself, and it made a huge impact on my life. This made me excited to know that there were exercises and daily activity changes that could truly help and provide answers. I sometimes wish I could go back and tell my high school self that there was a way to fix these issues and feel normal. But I am so thankful I was introduced to it through school. And I can now help other women and guide them on that same road to success, and know it is never too late to start. Today, I love being able to share my knowledge and experience to help women who struggle with similar issues. Again, the urinary leakage that I experienced happened without a specific injury or trauma. Now add the many changes that your body goes through during pregnancy and the birthing process. I am excited to share the ins and outs of pelvic health rehabilitation, specifically in regards to what is and is not normal and what to expect after pregnancy to help you get back to the daily activities and exercises you love. First, I wanted to give a brief overview of how pelvic floor exercises can help you after you have a baby. Building a strong pelvic floor can help prevent urine or feces from leaking. You will have more control with stronger pelvic floor muscles. It will also help keep your organs in the right place. You need strong pelvic floor muscles to support the organs that are above. Weak muscles will cause your organs to shift lower than normal. It will also help increase a better blood flow to your pelvic region. This will help your vagina stay happy and healthy. Another big concern is having painful intercourse, And doing pelvic floor exercises, again, can increase the blood flow to your pelvic region, which can help decrease friction during sex. Pain is another big issue following childbirth, depending on the issues you're experiencing. And targeting specific stretches to help increase your mobility in your pelvic region can help with lifting and moving and different tasks that you have to do throughout your day. I've heard from many patients, well, I had a baby, so leaking is normal. It's normal to leak a few drops after jumping. And yes, it is very common. It is not normal, and there are things you can do to decrease your symptoms. A lot of you are probably thinking, I have tried everything in the book. Well, I challenge you to keep an open mind and allow yourself to embrace your fears and insecurities, because getting started is the hardest part. This leads me to my last point. If one of the first two things I talked about didn't relate to you, then I'm sure this last one is, and that's time. As a mom, when am I going to find the time to begin addressing my issues, whether it's leaking urine or addressing that nagging hip or low back pain? This brings me to one of my patients. We'll say their name is Sarah. She came in and she was very interested in pelvic health physical therapy, but she was also going back to school full-time as a nurse. She was also finishing up her doctorate and had 2 kids under the age of 3. How am I going to make time for this? I then asked Sarah, what is one thing you like to do for fun? She said, well, I don't really do anything for fun anymore. And I said, okay, what is one thing you like to do for yourself? And she said, well, I guess I watch an episode of The Office each night. And I said, what would you say if I told you that you could do a lot of these exercises while you were watching that next episode of The Office, or even driving in your car, or doing cleaning tasks around the house? She was very intrigued. And once she looked at the end result and the thought of the time that she could work on herself, this allowed her to incorporate her pelvic health exercises into her everyday routine. Fast forward to our last visit, Sarah came in looking nervous. She looked at me and said, Liz, I did a jumping jack for the first time without leaking urine or wetting my pants. And this gave her hope and inspiration. She said she didn't think it was possible after having issues for this long to fix this or feel normal. If this is a problem for you, I would love to take you on the same journey that I was able to take Sarah and guide her through. I hope you are all able to take away some hope and inspiration from this short chat. I will be starting a 5-day masterclass challenge. It will be 30 minutes a day for 5 days a week. But what will this class include, you ask? What's the secret to mastering Kegels? How do I address pelvic pain and scar tissue? How do I stop that constant urge to urinate? How can what I eat and drink contribute to or play a role in my bowel and bladder dysfunction or issues? And lastly, what are some apps, exercises, and resources that you can use to manage your symptoms and issues in the long term? I hope you join me in conquering your goals and that this class provides a safe environment for you to openly ask questions and concerns regarding your pelvic floor. Please direct message me to register for the 5-day challenge. You will be provided with a secure link for payment. It is a one-time low cost for all 5 classes. Don't wait to register. I expect the class to fill up quickly. Thank you so much and have a great day.